guys, it's been a while. It's Bisharina and welcome back again to my vlog. So for today's video guys, I will be sharing a question and answer regarding nursing process, specifically your assessment phase. Okay? So if you're a second year or if you're a nursing student taking up fundamentals of nursing subject, this is for you, okay? By the way, I will not show my face because I'm so haggard na.
I wanted this love to survive.
Which of the following behaviors is most representative of the nursing diagnosis phase of the nursing process? 1. Identifying major problems or needs. 2. Organizing data in the client's family history. 3. Establishing short-term and long-term goals. 4. Administering an antibiotic. Okay, I'll give you 10 seconds to answer.
Okay, so the correct answer here is 1. Identifying problems or needs is part of your nursing diagnosis. Your item number 2 is part of your assessment. What about your number 3? Establishing short term. Okay, that's part of your planning. Your number 4 is your implementation phase. Okay? Which of the following behaviors would indicate that the nurse was utilizing the assessment phase of the nursing process to provide nursing care? Okay? 1. Proposes hypothesis. 2. Generates desired outcomes. 3. Review results of laboratory test. 4. Documents care. What's your answer? Okay, the correct answer is 3. Reviews results of laboratory tests. Remember guys, during assessment, data are collected, organized, validated, and documented. Okay? Your hypotheses are generated during diagnosing, and outcomes are set during the planning. And your documentation is your documentation occurs throughout the nursing process. So remember that, okay? Okay, moving on to question number 3. Which of the following elements is best categorized as secondary subjective data? 1. The nurse measures a weight loss of 10 pounds since the last clinic visit. 2. Spouse states that the client has lost all appetite. 3. The nurse palpates edema in lower extremities. 4. Client states severe pain when walking upstairs. What's your answer? Okay, the correct answer is 2. Okay? Remember, primary data come from the client. Okay? Whereas your secondary data come from any other source like your chart, family, di ba? And subjective data are covered or reported or an opinion. Okay? Whereas your objective data can be measured or validated. So that's your option 1. May nakalagay dyan na weight. Diba? Ano pa? For your option 3, may nakalagay na edema. Data can be measured or validated. Objective yan. What else? Okay? So, if the spouse had stated that the client had eaten only toast and tea, this would be secondary objective or measured data. Okay? Okay, question number 4. The nurse wishes to determine the client's feelings about a recent diagnosis. Which interview question is most likely to elicit this information? 1. What did the doctor tell you about your diagnosis? 2. Are you worried about how the diagnosis will affect you in the future? 3. Tell me about your reactions to the diagnosis. 4. How is your family responding to the diagnosis? Your answer, please. Okay, the correct answer is 3. Okay, eliciting feelings requires an open-ended question. Okay, that's tell me about your reaction to the diagnosis. Your option 1, that does more than seek factual information. Okay, and your option 2 cannot be answered with a single word. For your option 4, the family can provide indirect information about the client, but is that most likely to provide the most accurate information? Okay. Okay, moving on to question number 5. The use of conceptual or theoretical framework for collecting and organizing assessment data ensures which of the following? 1. Correlation of the data with other members of the healthcare team. 2. Demonstration of cost-effective care. 3. Utilization of creativity and intuition in creating a plan of care. 4. Collection of all necessary information for a thorough appraisal. Ano pong sagot? What's your answer? The correct answer is 4. It's collection of all necessary information for a thorough appraisal. Okay? So frameworks help the nurse be systematic in data collection. Okay? Your option 1, other members of the healthcare team may use very different conceptual organizing framework. So the data may not correlate. Okay? Your option 2, cost-effective care is more likely to occur with systematic application of the nursing process, but use of a framework for assessment alone may not accomplish this goal. For your option 3, because the framework is structured and because of the nature of clients' needs or problems, creativity and intuition in care planning are not assured. Okay. Which of the following is the purpose of assessing? 1. Establish a database of client responses to his or her health status. 2. Identify client strengths and problems. 3. Develop an individualized plan of care. 4. Implement care, prevent illness, and promote wellness. What's your answer? Okay, the correct answer is 1. Assessing provides a database of the client's physiological and psychosocial response to his or her health status. Okay? For your option 2, client strengths and problems are identified in diagnosing phase of the nursing process. Okay? Option 3, a care plan is established in the planning phase. Okay? And for your option 4, care, prevention, and wellness promotion are part of the implementing phase. Okay? Okay, question number 7. In the validating activity of the assessing phase of the nursing process, the nurse performs which of the following? 1. Collects subjective data. 2. Applies a framework to the collected data. 3. Confirms data are complete and accurate. 4. Records data in the client records. So the correct answer is 3. Confirms data are complete and accurate. So in validating, guys, the nurse confirms the data is complete and accurate. Okay? For your option 1, subjective data is collected in the collecting activity. For your option 2, a framework is applied to the data in the organizing activity. And the data is recorded in the documenting activity. That's your option 4. Okay, question number 8. A major characteristic of the nursing process is which of the following? 1. A focus on client needs. 2. Its static nature. 3. An emphasis on physiology and illness. 4. Its exclusive use by and with nurses. Okay, what's your answer, class? What's your answer? So the correct answer is 1. A focus on client needs. Okay? Remember, your nursing process focuses on client needs. Your option 2, it should be dynamic, not static. Okay? When we say dynamic, it's changing. Remember, your nursing process is changing. And when we say static, it's unchanging or fixed. Okay? Your option number 3 emphasizes client response rather than physiology and illness. And your option number 4 is collaborative rather than used exclusively by nurses. Okay? Okay. For question number 9, which of the following would be true regarding use of the observing method of data collection? 1. When observing, the nurse uses only the visual sense. 2. Observing is done only when no other nursing intervention are being performed at the same time. 3. Data should be gathered as it occurs rather than in any particular order. And number 4, observed data should be interpreted in relation to other sources of collected data. So what's your answer? I'll give you 5 seconds. Tut, 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 tut. I'm just kidding, guys. So the correct answer is 4, no? Observed data should be interpreted in relation to other sources of collected data. Your number 1 class, the nurse only use the visual sense. Hindi lang naman po visual ang ginagamit natin when observing. No? We use your hearing, your touch. Okay? And then, your number 2, ang mali dyan is our nursing intervention are being performed at the same time. We don't perform at the same time. Usually, we perform simultaneously. Okay? Your number 3, data should be gathered as it occurs rather than in any particular order. It must be systematic approach that the nurse to pay attention to important. Okay? Which of the following would be true regarding use of the observing method of data collection? 1. When observing, the nurse uses only the visual sense. 2. Observing is done only when no other nursing interventions are being performed at the same time. 3. Data should be gathered as it occurs, rather than in any particular order. 4. Observed data should be interpreted in relation to other sources of collected data. Okay? What's your answer? Okay, so the correct answer is 4. Okay? Observed data should be interpreted in relation to other sources of collected data. Okay? Interpreting collected data is necessary to help validate its accuracy. Okay? Your option 1, no? Observing includes the senses of smell, hearing, and touch in addition to your vision. Okay? Your option 2, using priority setting, observing must often be performed simultaneously with other activities. And a systematic approach to observing data help ensures nothing is missed and the nurse pays attention to the most important data. That's your option 3. Okay, this is the last question.
Which of the following represent effective planning of the interview setting? This is select all that apply, guys. Okay? 1. Keep the lighting dim so as not to stress the client's eyes. 2. Ensures that no one can overhear the interview conversation. 3. Stand near the client's head while he or she is in the bed or chair. 4. Keep approximately 3 feet from the client during the interview. 5. Use a standard form to be sure all relevant data are covered in the interview. Okay? I'll give you 15 seconds to answer. Okay, done? So the correct answer, guys, is 2, 4, and 5. Okay? The nurse plans the interview so that privacy is observed. Okay? Next, a comfortable distance between nurse and client to respect the client's personal space is about 3 feet. Okay? Using a standard form will help ensure the nurse doesn't omit gathering any vital information. Okay? Your option number 1, guys, is wrong because lighting should be at a normal level. Okay? Neither bright nor dim. Okay? What about your option 3? Your option 3 is wrong too. The nurse should be at the same height as the client, usually sitting, no, at approximately a 45-degree angle facing the client. The nurse standing over the client creates an uncomfortable atmosphere for an interview. Okay? Okay, that ends our quiz for today. Thank you everyone for watching. And don't forget to like, comment, and subscribe. Kindly also comment down your score, guys. Okay? Bye!